Volunteer State is leading the nation in new daily COVID-19 infections, and doctors are warning if nothing drastic changes, Tennessee hospitals will be pushed to the brink. Welcome to News 2 at 6. I'm Bob Mueller.
And I'm Haley Wilgus. State Capitol Newsroom reporter Gerald Harris has more on the concerns around where the state stands.
Tennessee is #1 in the U.S. per capita in daily new COVID-19 infections, even as doctors continue to warn of the dire consequences. Governor Bill Lee met with doctors recently regarding the pandemic.
We agree that we don't agree on every issue, but that there are many things we agree on, and we're going to try to work together.
This as pediatric COVID-19 cases have hit a record in Tennessee. Doctors say uniform masking, testing, vaccination, and distancing are just some keys to mitigate the disease. Since the beginning of the pandemic, however, Governor Lee has stood firmly against implementing any mask mandates.
We do think that the strategy we're taking is the one that is the way forward, that best navigates the circumstances we're in.
But children are taking the brunt of the rapid COVID-19 spread under the governor's strategy, making up 40% of the state's new cases, as Lee allows parents to opt their children out of school mask mandates.
It's just ridiculous for people to go out on the limb and try and influence others not to wear masks when it has been proven that the masks are effective. And my heart goes out to all those children who have been infected simply because the parents don't want them to wear a mask.
Former Republican Senator and Dr. Bill Frist is calling on Governor Bill Lee and other state leaders to do more, tweeting in part, "Without action, hundreds, even thousands will needlessly die whose lives could have been saved."
We are bursting at the seams. Our ICUs are completely full. Our hospitals are more than 50% filled with COVID patients. Limited resources are starting to impact our ability to take care of folks.
Dr. Jason Martin, a Sumner County ICU doctor who is running for governor of Tennessee as a Democrat, says Lee has a responsibility to do more to address COVID-19 in schools.
The virus sees a human host. It doesn't see an adult. It doesn't see a child. And so if we want to mitigate the spread of the virus, we all need to act together. And so that means being socially distanced. That means wearing masks when we are in close proximity to one another. That means getting the vaccination as soon as you're eligible to get it.
In Nashville, I'm Gerald Harris.
Now, Governor Lee has allowed for staffing flexibilities in hospitals by executive order. His administration has released millions of dollars to assist hospitals with staffing shortages. Lee is also encouraging all Tennesseans to get vaccinated.
Well, today, more than 6,700 new cases of COVID-19 are reported in Tennessee. More than 2,300 of those are children and young adults up to the age of 20. There were 76 new deaths, and nearly 25% of all tests taken in the state are coming back